What we have at the moment is that it's been misconstrued. The NHIA system has no challenge as we speak. The NHIA has two means of trying to develop, just as you rightly said, a CC code for claims. So either you use the star 842 or the ccc.nhia.gov.gh to do that. The challenge at the moment is the lightweight health information management system, what we call the LIMS, used by the various facilities. That is regulated by the Ministry of Health. So what happens is that gone by the day, somebody has to pick a folder, go through all the process from lab to pharmacy and all those ones. Now, the person at the comfort of his office clicks on your details, the code you have generated, and can prescribe for you to either move to the pharmacy or to the laboratory. That is where the challenge, the system is down. It's not controlled by NHI, it's controlled by the Ministry of Health. Notwithstanding, no member of NHI goes to a facility now that should be asked to go home, because that will not still really affect service. It can only delay the process, but it should not entirely affect service. So all health providers still have the opportunity of still generating the code and coming to make input on the claims direct without necessarily going through the LIMS, pending the revival of the LIMS challenge. So we have deployed almost our district staff and all those ones to go to all facilities, help and assist, so that we don't still have members of the scheme being asked to go home just because LIMS is down. LIMS being down should not affect service in any way.
So since it's not managed by NHI, I just want to find out how often is the digital infrastructure audited for stability and security?
The reality is that because it doesn't really fall under us, there are two different platforms altogether. And because I don't speak for the ministry, forgive me, I'll not be able to tell exactly what the problem is and how often they work on that. That I have to be emphatic. Our concentration is that if the challenge has to do with the generation of the CC code, either using any of our platforms, either the star 842 or the CCC and the NHIA.gov.gh, that is fine. That consistently we monitor to make sure that we don't have such challenges. But the ones which does not fall under us, but directly under the ministry, we'll leave that to the ministry. I'm sure it's something they are working on. But what is most important is that this is not still supposed to affect services as far as rendering service to our members are concerned. Not at all. Any facility that has a challenge can still call the call center. We have district offices staff we have deployed to go to various facilities to ensure that our services still move smoothly and does not affect the provision of service in any way.